is Heart Health Month. Here in Louisiana, we love our good Cajun and Creole dishes, but some of those dishes can be high in cholesterol and saturated fats, and eating too much of that can increase your risk for heart disease. We spoke with a local cardiologist about how to keep your heart healthy. Over 700,000 people in the U.S. died from heart disease in 2022, according to the Centers for Disease Control and Prevention. While heart disease can come in many different forms, the most common and most life-threatening is blockages in the arteries.
Heart failure is a situation where the heart does not supply the amount of blood that the body needs to meet its demands. Atrial fibrillation is a very common form of abnormal heart rhythm.
Dr. Taylor Knipp is an interventional cardiologist with Christus Ochsner St. Patrick Hospital. He says there are certain risk factors you can't control when it comes to heart disease, like age and sex. There are some lifestyle changes you can make to reduce the likelihood of developing it. Physical activity, 30 minutes of moderate to high intensity exercise 5 times a week.
Trying to eat a diet that's balanced in fruits and vegetables and lean meats and avoid refined carbohydrates and high salt and saturated fats.
Dr. Knipp says the Mediterranean diet can make a positive difference.
Obviously, that's not what we eat here in Southwest Louisiana normally, but we know that patients who adhere to only portions of the Mediterranean diet, their reduction in heart disease risk goes down depending on how much they adhere.
If you have symptoms like shortness of breath at rest or with activity that's coming on rapidly, or abnormal heart rhythms that present as palpitations or fluttering in the chest, Dr. Knipp says that you should speak with your doctor.
Every patient should have a baseline cardiovascular risk assessment early in life. You should get your cholesterol checked at the age of 18. You should get your blood pressure checked by a healthcare provider at least once a year.
If you're a patient who is at a higher risk, Dr. Knipp says when getting a baseline cardiovascular risk assessment done at an early age, your risk of developing symptoms of heart disease later in life can be effectively prevented early on.